Caitlin Stauring, thank you so much for being here. It's been a while since we had a chance to work together, but we really appreciate your time and the giving back as you have been doing and as you continue to do. Tell us about your current job and what you do, and are there any certifications or anything that are needed for that?
Yes, absolutely. Thank you so much for having me. So a little bit about my current role. So I'm an IT project manager with Orlando Health, which essentially means that I'm responsible for overseeing end-to-end technology rollouts for various aspects across the organization. Every project is a little bit different from the next. So it might be clinical, it might be revenue management based. And so each project is a unique opportunity to really get to learn and understand the workflows within the organization, as well as get to understand the technology components that are needed in order to support the organization. So all in all, it's overseeing end to end from scope, schedule, stakeholder management, communication, end to end, to ensure that technology is successfully rolled out and that our organization is meeting the benefits that we're looking to achieve from the projects. A couple related certifications that I have that prepped me for this role include the project management professional certification with the Project Management Institute. This has been a pivotal certification. There are a couple different ones with the CAPM and the PMP. And this teaches you about the methodology for project management end to end to equip you to understand the different knowledge areas that come into play when managing a project. The other certification that I have is the Lean Six Sigma Yellow Belt and Green Belt, which focus on Lean and Six Sigma methodology. This comes into play to really understand when you're rolling out, whether it's for process improvement or even a regular project, it helps to really shape your mind in the way that you think about reducing any inefficiencies when you're rolling out new technologies. So those are the two certifications that I have for project management.
As I've talked to recent grads and over the last 10 years, PMP keeps coming up as one of the top certifications. If you have that skill set, it makes you much more marketable. So let's pivot a minute. Tell me about uh, your program here at UCF. Why did you pick that program, and you know how did it work out for you?
Absolutely. So the MHA program at UCF, a big reason why I selected it is actually because of the encouraged in-person collaboration and classes. That was probably actually my number one factor, as well as the Central Florida market has many healthcare systems. So our program is really rooted in an area that is thriving within the healthcare community. So the coursework in our classes, it was very real world focused and based, as well as encouraged involvement within professional organizations such as the American College of Healthcare Executives, which was pivotal for myself to get to go to education events and learn about all different topics throughout my time being a student, as well as get to know and interact with current healthcare professionals and leaders.
So I want to dig into that just a little bit because our history is a little bit different than many other students that come through our program because you served as the chair of the ACHE Student Associates for ACHE of Central Florida. Um, when I think about the times we worked together, I was always amazed at how you managed to do everything you were doing with your personal life, with full-time school, with a full-time job, and still dedicate the amount of time that you did to that role and to ACHE, even as a student member. So, what in the world, Caitlin? Why would you do that? Seriously, you actually reformatted with your project management skills. You reformatted our program enough to give us a lot of tracking and a lot of uh, leverage going forward to keep the program going. So, tell me about all that. How'd you do that?
Yeah, so I think my mindset in starting the master's program was very much so that I'm going to dedicate, especially these years of my life, to be as involved as I possibly can within the industry. I was going to go for every opportunity that I possibly could to learn, to connect, to take the certifications that I had and really apply that and to develop my skills and my leadership and put that into practice. So it was really a mindset over those 2 years that that's what my life was, that I was dedicated to learning and advancing and just building my skills. Definitely it was a lot to juggle. I wouldn't change a thing. I think that all in all, the program was phenomenal. I got to meet so many amazing people. I learned so much. To my involvement with ACHE, I treated it as another job because I
Mhm.
just was really passionate about it and about the field and excited to be taking everything that I was learning and finding unique ways to really apply it and to showcase that in any way that I could. I frankly I enjoyed it, and I think that if you find ways to really enjoy what you're learning and not only absorbing it, but also finding ways to execute it and display, it can be a lot, but it's an enjoyable time period for your life. And so finding ways to manage that, focusing in on work from 9 to 5, having class from 6 to sometimes 8, 9, doing homework late nights, and then juggling in extracurricular. It might have been a lot, but it was well worth it. And I would encourage anyone coming into the program to take these couple of years and really go full force into them, because the outcome of doing these things is exponential. So
So because of your role, you actually were a part of the board for ACHE of Central Florida, maybe not in a voting capacity, but you were there in the meetings, in the discussions, and people look to you for your feedback and your input, which I think that's really important. But we talk to our students about the importance of engagement, and I keep telling people, a lot of students come to me for a reference letter. And in the reference letter, if I say, I know this person because they took a class, that reference doesn't mean a lot. But if I can say this person was active with ACHE and list all of the different engagement levels. So you think your program and your participation in ACHE helped you as you have developed your career since graduating?
I do, absolutely. To this day, I'm still heavily involved with ACHE. Getting to be a part of these different opportunities, it gives you the exposure to learn and to ask real world questions, and to bring that back into the program as well, and to, bring that into your classroom discussions, your discussion board posts, and then even posts. I think that that knowledge, it's something that it's it's invaluable. Once you take that engagement and then you move on with your program, you don't lose those connections. You don't lose that knowledge. You're going to take that with you for the rest of your career. And so to me, I would say 100% being engaged and getting to have those interactions and experiences, it's really shaped who I am as a professional. Um, and yeah, pushed me forward significantly in my career. So.
Yeah, it's not to mention the fact that you're networking with people that are in the field, mid-level
Yeah.
executives and even some senior executives. So you build your network, and we know that that's one of the most efficient ways to pursue your career advancement. So we've got just a couple of minutes left. Uh, what tips do you have for students? Anything you wish you had known when you were coming through that you know now, or what advice would you give if some student said, "Hey, Caitlin, what do I do?"
There's kind of two things coming to mind. One of them is that I read a book. It was called The Defining Decade. And while the book focuses on your 20s, you don't have to be in your 20s for this advice to apply. But it essentially says that if you take a decade of your life and you hone in and you get incredibly intentional with yourself, with your relationships, with your education, with your finances, and you really take a good look and you get control over those things. And it can feel a little bit uncomfortable, but if you take that mentality into everything that you do and you're incredibly intentional, that will lead to positive outcomes. And so that would be the first thing I would say is just come into it with absolute intentionality. This is your time to learn, to grow, and take advantage of that. Take advantage of the opportunities that this program offers you. Join ACHE, get involved, because at the end of the day, having this intentionality mindset, it's for you. It's about you. You're going to leave your impact the strongest if you're able to really, prioritize and think of yourself in this way. The second thing, I would continue to emphasize ACHE. You will learn so much from the people around you. Getting to, sit and listen to a panel of leaders, whether it's on quality and safety or technology or revenue management, no matter what role or pathway you choose in healthcare, it's incredibly interconnected. And so getting that knowledge and being involved and getting to meet with these other individuals and professionals, it will really serve you very well. And so those would be the two things that I would strongly encourage.
Well, I can't thank you enough. I miss you when you haven't been here in the office working on the ACHE stuff, but I'm really proud of what you've done and what you're doing with your career. And I know you're going to be successful. But from all of us here at UCF, thank you so much for all you've done and all you continue to do.
Thank you so much. Thank you.
Thank you.